So the Trump administration came out yesterday and said that the use of acetaminophen in pregnancy increases the risk and is a cause of autism spectrum disorder. So this is probably a good time to review the research and the data that's out there already. So I went to go to PubMed and look for systematic reviews. So I went to PubMed and I found a systematic review of the link between autism spectrum and acetaminophen. And just to be clear, if you're ever looking for research or ever trying to do research on your own or look up things on PubMed, you want to look for systematic reviews because that is the highest level of evidence. In the abstract for this review, it says they found a wide range of neurodevelopmental outcomes, including IQ, ADHD, isolated language, attention, executive function. And look at this highlighted part. All studies showed an association between acetaminophen use and listed neurodevelopmental outcomes. Long-term use, increased dose, and frequency were associated with a stronger association. So is the Trump administration absolutely right in this situation? Does acetaminophen use cause autism spectrum or contribute to it? Well, I wish research and medical understanding of things was that simple, right? Like 1 + 1 = 2. But the reality is when you're doing research and you want to find a clear understanding of what's going on, you have to explore any sort of confounding variables. Meaning what's going on with people who are using Tylenol a lot in pregnancy. Well, look, they're not just popping Tylenol because they feel like it. They likely have fevers or infections or other reasons to take Tylenol. It could be the case that it's not the increase in Tylenol that is causing an increase in neurodevelopmental issues. It could be the health of the mother. Now, you might be saying like, all right, well, it seems like there is still a small correlation between the use of Tylenol or acetaminophen and neurodevelopmental issues. And that may be true, but what certainly is true is risk of untreated fever in the fetus causes neural tube defects, heart defects, other birth defects, and developmental problems. So we know untreated fever definitely causes these things. And for the mother, it's at risk for premature birth, infection, dehydration. The reality is nothing in medicine is 100% safe. But we don't look at the world as black and white. You definitely should not take Tylenol, pregnant or not, if you don't need it. But you definitely should not let a fever go untreated when you're pregnant because we know what the outcome of that is. It's always a risk-benefit analysis and it's always wise to consult your doctor when making these decisions. But blanket statements like acetaminophen causes autism is just factually incorrect. And my hope is that we really don't politicize medical care.